Hi, I'm Anjali,
I'm Bhavani.
And I'm Nishka.
and today we're going to talk about contraception.
Alright, so in October, the Trump administration issued a rule to allow employers, insurance companies, and universities to deny coverage of contraception to their employees on the basis of moral conviction, which does not even have to do with religion. So previously, employers, insurance, and universities were able to opt out of providing birth control in their health insurance based on religious beliefs. But now this has been expanded to moral convictions, which does not even have a definition. It's not defined in the mandate. And it's very unclear what that means. Like, what do you guys think these moral convictions would be?
I think it's an easy way out.
Yeah, it sounds very arbitrary.
It's like a
Yeah.
get out of jail free card.
Yeah,
right?
it sounds like
That's what it
they're
is.
just trying to save money.
And yeah, but we're still paying for their insurance. Like Congress still has health coverage with, contraception in it. So why do we pay for them and they don't pay for us?
Without health insurance, the pill costs $50 a month and $600 annually. That's like how,
I'm not gonna pay that much. That is a lot of money.
like we're gonna have to decide between eating and paying rent, not being pregnant. Like that's just crazy. Like
You know what's funny is that I thought we were trying to reduce abortion rates, and now it feels like
pregnancy.
I feel like that's just gonna go up now. So isn't this working against it?
yeah, this is like the very first step you could take to ensure that more people get pregnant. And abortions, because so many young women just can't afford to spend this much more money on contraception. I mean, so many of our friends have had pregnancy scares, even with the pill or condoms being free and included. So what's going to happen now? Like a lot of them are on very tight budgets. I honestly feel personally attacked.
I do feel attacked.
Like
Sad.
it's just like even with the pill and condoms, like sometimes our friends would buy pregnancy tests and they would run to about $30 or something in a Duane Reade, and there's also so much like shame or stigma attached to it that they'll want one of us to buy it, for example, and pretend it's for someone else.
I don't understand how you can take
It should definitely be affordable, and now that employers aren't providing it anymore with included in health insurance, don't have to based on totally
Moral
arbitrary reasons. It's like most young people can't afford
They
it.
can't afford it. What if a guy comes up to me and is like, "Oh, I'm not gonna buy condoms because I can't afford them." So
And of course, then a lot of people will revert to unreliable methods such as
pull out.
like the pull-out method, or like we haven't even talked about STDs. Like if people are just gonna try to not get pregnant and not use condoms, and then what about all these extra costs for sexually transmitted diseases like chlamydia?
Plus, it's scary, like going to the office to get tested just because the guy didn't want to use a condom or something like that. I think that's messed up.
And doctor's visits are also expensive. You have to pay for that. So, obviously it's not making birth control illegal, but to just deliberately cut it out of an insurance plan, and that businesses can decide themselves on completely arbitrary moral convictions.
I would like to know what this is. I want to know what moral convictions are. That's just
This would go into effect on December 5th, by the way. I know a lot of our friends would get very worked up about this because they try to go to Planned Parenthood to get the cheapest or like the most free. Yeah, people go to Planned Parenthood. People go to the University Health Center. And I know like being in college, everyone's like on a super tight budget. And having this as an extra burden on top of food and rent and textbooks and just to not get pregnant. That's
why are we even putting a price on that?
It's 2017 and we have to maybe resort to the pull-out method soon. Other methods of contraception are also extremely expensive. Like a contraceptive shot costs between $35 and $75 each. And then you also have to pay up to $40 just to visit a doctor. And why would businesses want to opt out of paying for birth control if they don't want their female employees to get pregnant and go on maternity leave?
Yeah,
like,
exactly.
so it's pretty safe to say that preventing pregnancy is expensive.
Breaks the bank.
Yeah, because there's obviously more methods of contraception than condoms and the pill, which are the most known and widely used ones. But for example, if you want to get completely sterilized, which, I mean, it's a permanent procedure, it would cost $4,000 for such a personal decision. Like, what you want to do with your own body comes at such a steep price.
That's a lot of money.
Yeah, I really think this is a bigger issue than just
Yeah.
battling teen pregnancy. It's really taking away the right to decide what we want to do with our bodies. And
So this mandate comes out December 5th, and that's very soon. So
speak up, weigh in, raise your voice.
check it out online.
It's
Read up about it.
some scary stuff.
All right. I'm Anjali,
I'm Nishka.
Bhavani.
signing off.